Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we are really excited to have you here because we're having some incredible conversations with real leaders that are painstakingly reshaping the future of healthcare. We're passionate about a few different areas. We're passionate about healthcare innovation, adoption, leadership, and access. And if it's your first time tuning in, let me just sort of take a quick step back and tell you just a little bit more about what we're trying to do here. So we're focused on bringing real stories of innovation to life, not just talking about the wins, but also talking about the learnings. Folks that are really actually getting stuff done in the trenches, giving them the opportunity to share their stories with our community and ultimately with the world. We've got an amazing action-packed year. If you haven't had the opportunity to check out any historical interviews, wherever you are, wherever you're watching this or listening to this, just make sure you hit the subscribe button now so that any of the new interviews come directly to you and you can check them out. So in our field, things are consistently evolving, things move fast, and it's crucial to have leaders that can envision the future and eagerly embrace innovation to address a lot of these pressing challenges. And if you're new to healthcare, you know that, or if you're a veteran of healthcare, you just know that we've got a lot. We don't have a shortage of challenges, which means that we've got a lot of opportunities to make things better. Our next guest on the show is actually one of these leaders. So there's a quiet crisis playing out in post-acute and long-term care. Clinicians are drowning in documentation, nurses are buried in PDFs, and too many providers are forced to choose between paperwork and patients. Justin Quall saw that problem head on. And instead of building another dashboard or chasing the next buzzword, he built Oler Health, a company that's quietly revolutionizing the operational backbone of care delivery. Oler helps clinicians cut through the noise, automating the extraction of critical data from bloated referral packets and transforming them into insights that drive better care and accurate reimbursement. It's the behind the scenes solution with frontline impact. That's kind of the way that I think about it. And in a system where minutes matter, Oler is giving providers their time and, quite frankly, their sanity back. So Justin's not just a CEO, he's a systems thinker with an operator's edge and an investor's precision. So what he and the team are building, it's pragmatic, it's grounded, and quite frankly, it's urgently needed. So in this conversation, we're going to unpack a few things. We're going to unpack, what it takes to build infrastructure that actually works, and even the bigger question that every healthcare founder eventually faces. Are you solving the right problem or just building around the wrong one? So Justin, welcome to the show. It's great to see you. How are you?
See you too, Michael. Doing well, and thanks so much for having me on AHI.
Yeah, no worries. So Justin, before we kind of dive into Oler and post-acute care, I wanted to sort of start somewhere unexpected. What's one belief that you held earlier in your career that you now think is completely wrong?
Hmm. Let's see. One thing that was always interesting to me, starting out in healthcare and attending different healthcare conferences, is basically the lofty expectations that were put on the healthcare sector as different systems went from paper to digital. I remember I'd go to conferences, 5, 6, 10 years ago, and it seemed like every time the answer was coming right up, and it would be fully online by next year. So full, liquidity of healthcare data flowing between different parts of the healthcare sector, from hospitals to nursing homes, hospitals to home health agencies, for example. And there was certainly no lack of effort, no lack of funding. Thinking about the 30 to 40 billion dollars that went behind the High Tech Act, for example. And I just remember I'd go to the same conference, the next year, and I was expecting for some, big updates. But at the end of the day, the challenge of really having information flow from one place to another and be, fully digestible, just remained. And so, to your earlier point, that's kind of what led me away from the buzzwords, and
Yeah.
towards, something tangible, something I, kind of experienced firsthand while doing the EMT thing.
Mm. So you've you've worn a few hats. You're a CFA, you're an operator, now a founder. Let's just say you had to explain your job today to your younger self in one sentence. What would that sentence be?
Sentence would be what we do is software to help make paperwork less painful for healthcare providers.
Hmm. So then take me back to the moment when the idea for Oler Health first clicked. Was it a slow simmer? Was it a lightning bolt, an aha? You mentioned you being an EMT. Take me through that.
Yeah, so I would say it built up gradually. Um, so I was moonlighting as an EMT, doing a 10 each weekend for a couple years on a catchment area from Boston's South Shore to South Coast. And I absolutely loved the job. You know, it got me out of my tiny little studio, especially during COVID when I'd otherwise be cooped up. And instead, I got to be out and about, feeling like I was making things a little bit better and helping out a time when the system was just super strained. And one thing I didn't like about that gig was, the little, 10 to 15 page discharge summaries I had in the back of the ambulance. So for me, that was brutal. It was something that came in between me and understanding what was actually going on, what the
Mm.
patient actually needed. Something that came in between, me and building rapport, building, trust and a good conversation with the patient. And so I felt surely other people would have, similar frustration with paperwork. What I didn't realize is that I had it really, really easy. So those 10 to 15 page discharge summaries, feel much more commonly like, 80 to 100 page whoppers for those individuals, assuming care for those patients for a time period longer
Yeah.
than any ride. And often, it ended up being 200 to 300 pages for some of the more complex patients who need more support, more help. And then, you introduce the pain points.
Does anybody actually read the 200 to 300 pages? Let's be honest. I mean, that's a novel.
It's impossible. Yeah, it's absolutely impossible. There can be important things that come up as needles in the haystack, but folks are so burnt out, getting through COVID, surviving in more ways than one. So you've got, that going on. Well, there's an ongoing staffing crisis in healthcare, especially for nurses, and just everything else that they're being asked to do.
Mm. You know what? I'm just thinking as you're talking about this problem, a lot of startups, and I've come across a number of them, and as of you, they chase, I'll just call it glamour metrics, funding rounds, different partnerships, or hey, we're hosting this webinar. And yet, when I look at Oler Health, you've chosen a problem that's deeply unsexy. Um, Administrative overload and post-acute care, it's unsexy. However, it's so needed. Did that ever cross your mind when you decided that you were going to be building this company? That, hey, this is an unsexy problem, but you know what? It's a necessary one. Like, I'm just sort of curious if that ever happened across your mind.
Yeah, no, absolutely, it did. So, I quit my prior full-time job in August of 2022. And I basically, saved 2 months to think about all the different ways that I might be able to help, different ideas to start a new venture. And at the end of the day, this was probably the least glamorous out of all of them. But what was different, it was just the most tangible. It felt like something I could explain, to somebody working at a gas station. And it felt like the kind of thing where if I mentioned what I was doing, could, really get people's attention and be able to explain it in one sentence.
Mm. And you did masterfully, by the way. You talk about, reclaiming time for clinicians. And as you've gone deeper into this problem, I'm just personally interested. I mean, what's like the most absurd time wasting thing you've seen, a nurse or a care team have to do?
Hmm. I mean, I think it just all really adds up. It snowballs into an absolutely impossible workload. So it's not necessarily any one particular thing. I can give you a couple examples of some that seem more outlandish. Um, but it's really just the workflow of, getting, 100, 200 pages, and being expected to make it through all of that on a busy day with a bunch of other things going around and translating that into basically a 60-page report. Basically a person being expected to take that amount of unstructured data, which by the way is just increasing all the time for a lot of different reasons, and then fill out something that's 60 pages long, and having that get in the way of doing things like, actually reconciling medication list, or spending more time at the bedside, building a relationship with the
Mm.
patient, with getting a better understanding of what's going on. So the core workflow is a lot. Some of the more absurd things kind of on top of it include the concept of ADRs. So that stands for additional documentation review. And that's basically where an insurance company can have a skilled nursing provider, so a post-acute provider,
Mhm.
substantiate, re-go through all the documentation and prove why the resident needed that level of care. And residents often, if they have the choice, they'd rather go home. So we're really talking about the highest acuity, the highest frailty cohort of patients in the whole healthcare system, that are going to get some post-acute care, trying to get better. And then, on top of all the other documentation requirements, all the baseline things, sometimes external parties can have those post-acute providers basically redo all the workflows and substantiate it to somebody who's never taken care of the patient, in their lives, or even gotten close to interacting with that patient.
Wow. Just even just thinking about all the time, energy, and effort that is placed into ADRs. I mean, that's uncompensated time in a sense, right? That's time taking away from high level priorities, high level activities. And then I think about what you and the team are doing. I mean, you're automating and you're grabbing these insights from these massive packets of, they're coming in PDFs, right?
Most commonly, yeah.
Okay. That that sounds simple until you probably try it. What's been like the biggest technical or human challenge that you've run into so far on this point in the journey?
Hmm. I think the biggest challenge is really just the heterogeneity, and the messiness and the unstructured nature of all that information coming in. So one small correction, I wouldn't say we automate the workflows. We have a strong belief that you really need a human in the loop because we're talking about really high stakes, assessments that go into the clinical care being provided. So we're helping folks get through that mountain of documentation, and it's making them faster, but it's not replacing them. That's a core design principle and expectation of ours for at least the next decade. So the thing that can be really challenging is two hospitals on Epic can have totally different charts coming through, and so these post-acute providers, it's not like one hospital on Epic is going to have a similar output to another hospital on Epic. It's all a total, almost random sort of sets of inputs, and then all the structural things going on just make the volume just go through the roof. So the
Mm,
idea of value-based reimbursement systems. The good thing is, it basically incentivizes more thorough patient assessment. The downside is it's just rocket science. If you put Rand Corporation and Harvard and HHS into a room and ask them to come up with a system, you're going to get something really complex, and that's exactly what happened. And not thinking about the realities of the workflows going on. So you've got that. You've got ambient documentation. You got something
yeah.
that's helping the providers dramatically in the hospital setting, and they're loving it. But what's downstream? It's folks who, as a result of the ambient documentation, just get more unstructured data, more pages to go through, and it's just untenable.
So what's solving in one instance is actually creating a major problem for another instance, right? So it's like, hey, we're solving this thing, but now everything else is getting pushed downward. And I also just want to make note, you're not automating the workflow, right? I think what I wanted to say is you're automating some of these insights. So you're basically saying, hey, let's pull up the right information at the right time so that a human can intervene and take from a directionality standpoint. That's Do you have to commonly share that, with potential customers, with future partners to let them know that, hey, we're not necessarily just looking at removing humans from the loop here. Humans are very much important. And how do they initially react to that? Does it sort of diffuse pressure when you position that accordingly, when you frame that accordingly?
Definitely. Yeah, I think there's a lot of anxiety around AI right now,
Yeah.
to make an understatement there. There's also a lot of disillusionment thinking about the whole Gartner, hype cycle and all of that. For us, usually when we get to the demo, it just clicks for folks right away. The whole idea of, what human in the loop means. Um, and we stress, how important it is to really get that combination going. The combination meaning what are humans really, really good at and what are computers really, really good at. And there are a lot of different parameters by which, a sidekick, a co-pilot model really, really makes sense.
Mhm.
But to oversimplify it, computers are really good at memorizing, the thousands and thousands of different, conditions and high risk medications and all of that can come up. What humans are really great at is putting it all into context. And once all the potential things are on the table, making a judgment call on what matters. And so our view is that, there's really no replacement for that clinical judgment and critical thinking that the human reviewer brings to the table. So what we can really
Mm.
offer is making it way easier to find those needles in the haystack, those clues buried deep in unstructured documentation, and then tee them up for people to make a clinical decision on what's needed, what's appropriate, so on and so forth.
Is that one of the things that in terms of what Oler Health is doing, is that one of the sort of proudest things that you can say is that you're able to find these needles in a haystack? Or is there something else that you think kind of pops that?
Yeah, I think that's probably the biggest single one for me is hearing, intake nurses say, "Hey, there were orders for continued antibiotics for a patient's, wound infection, and they were buried deep in the hospital paperwork, and I didn't catch them on my first review, but Olair helped me find it." Those sorts of things where all systems kind of align, where the clinician's saving a little time and is, happier, less burnt out. The patients are getting what they need, and then the sniff chain sees how it's all aligned with their business goals like that. To me, that makes it all worthwhile for sure, all the late nights and weekends and whatnot. And then the second thing is just by freeing up a little bit of time for those intake nurses, those clinicians. The biggest group that we support that we work with are MDS coordinators, who are the
Mhm.
ones who have that workflow of 100 pages on the left side of the desk to make a 60-page report on the right side of the desk, and the instruction manual is 1,000 pages, and there's lots of gray zone even across those 1,000 pages. By saving them a little bit of time, helping them feel like they are able to get to the things that they wanted to get to, but it was impossible for them to get to before. Things like, again, actually reconciling a med list, following up with the hospital to have a more, thorough transition of care, and accountability transfer. That's really the reason why we're doing it.
Mm. I want to shift gears a little bit. I want to kind of focus on just you as a founder, you as a leader, and having interviewed multiple founders, there's a lot of things that are coming at you. Lots. I'm just sort of curious, where do you go to think clearly? What's your way of getting out of the way?
Yeah, I think it's always nice taking a walk around the block. So living here in San Francisco, we, have really solid weather in my opinion year round, and we have a lot of nice hills. So it can be a really good thing to make myself present, just to take a stroll, up the hill, around the block, down the hill, that whole thing. So that's
Mm,
nice. I worked as a caddy for 7 years while growing up, and so not as good of a golfer as I was back then, but going to the golf course and being out in the green, out in the fresh air, that always makes me happy too.
mm. So it sounds like then changing your environment. So change of pace plus change of environment gives you a fresh perspective. have you, in your journey so far, um, any stumbling blocks, any moments where you feel like, man, this is kind of a big wall for us to climb? Anything that really you or have a willingness to share, where maybe it was like, hey, is this gonna make it? Is it not gonna make it? Talk about some of those things that you're dealing as a founder. Just from my perspective, just to give a little bit of context, you seem very cool, calm natured. Is there a time that Justin is not cool and calm? And what's that like?
Great question. Well, it's interesting I come across that way because definitely how it feels inside, maybe the
Yeah.
whole duck on a pond analogy is one that makes sense here. I would say the first year, just in general, was just incredibly stressful, and just a massive amount of work. I think we had to get a certain critical mass before we felt comfortable putting Olair in the hands of clinicians to use it. And so what that meant, for my co-founder Jerry and I, was really just putting our nose to the grindstone. There's
Mm.
no way to sugarcoat it, in terms of making the product as high of quality as we can. It takes a lot of work. So in the first few months, I remember going through 45,000 pages of medical documentation and looking at all the different ways that a condition could be mentioned, just to increase the percentage of the time that we'd be catching it, to make sure that our recall percentage was at least as high as what we see in terms of humans picking it up manually. So that was a lot. And then, when you're
Sheesh,
negotiating.
45,000? My goodness. Just drowning in paperwork all day.
Yeah. Yeah, it was a lot, but to us, it's a really important part of our philosophy. We feel like we really need to eat our own cooking. So our head of customer success, Greg, who's just an amazing individual in a lot of different ways. He and I, whenever we're working with a new partner, we go through the workflow dozens and dozens of times from their perspective, looking at their charts. And to us, it's really important to be able to really empathize, be able to talk about our software not as hypocrites, but actual folks that have gone through the workflow and can attest that yes, if in their shoes, we'd want to use the software. Yeah, it's just part and parcel of what we do.
Yeah, just talk about that for a minute. Maybe even just how you found your team early on. There's often talk about how important it is to build a team, and we get that, but it's hard to find good people. How'd you find Jerry and Greg? Like, how'd that happen?
Yeah. So definitely feel just amazingly fortunate in terms of the team that's come together. Uh, so Jerry was the first one I linked up with as my co-founder. I knew him from a previous gig where he shouldered just he shouldered a huge load, of basically building a dashboard, that was used by 600 or 700 clinicians to
Mm,
basically do population health, look at what patients would need the most help, and when, to avoid things like
mm.
hospitalizations, exacerbations of chronic conditions, unmet social needs, all sorts of different considerations that went into it. So I was just amazed at his technical ability from that role. And then he went and joined a venture-backed document processing and AI operations company. And so putting that all together made him the perfect technical co-founder. I tried putting together my business experiences and the EMT moonlighting, and then we came together. And then, bootstrapping, it takes a little while to build up the critical mass to expand the team. But we were able to do so around the middle of last year, where Asta came on board as just a true force in engineering, and she'd worked with Jerry before, so there's a level of trust and uh, telepathy there that is really difficult to replicate, in terms of strangers coming together and building something together. And then super fortunate that Greg decided to join the team as our head of customer success. And he's just been doing huge things there and getting our customers a level of service that in most cases they've never seen before in terms of another healthcare IT company they're working with. So Greg and I do a lot there. And then recently we added Deb over in Michigan, who's leading implementations and customer support. And Deb is just an amazing professional and brings a lot of amazing virtues to the team.
I just want to highlight the path that you're going down initially, which is bootstrapping. And oftentimes there's sort of two schools of thought, which is raise money immediately, which fundamentally it's not both are neutral, right? It just depends on how someone feels about it. But fundamentally, when you raise money, you have to get good at spending it versus bootstrapping, which is, hey, let's hone in on this problem. Let's shape the problem. Let's go deep into the problem and what you've illustrated earlier, which is going through these workflows, experiencing this, but then getting good at solving the problem well enough where you can get good at making money. And I think they're two fundamentally different skills. Can can you maybe talk a bit about that bootstrapping and just being very conscientious of every dollar? How do you think that the journey of Oler Health right now would be different had you taken money early on, or just maybe jam on that for a little bit?
Yeah, I would say the biggest benefit to holding off on raising has been that we've just been able to get to a degree of depth with our current partners in our first segment that we wouldn't have been able to get to had we raised money. We do see a lot of market expansion opportunities, other segments that we can help, like we're doing for skilled nursing facilities today. But those segments are all totally different ecosystems, totally different worlds. So had we raised money, I think there'd be most likely more pressure to launch more products, serve more segments very, very quickly. And that would replace being able to really, come into our current customers, our current segment, and position ourselves as partners.
Mm,
Um, so it's been just such a luxury to be able to really just, lean in, listen to what our customers want, be able to deliver upon that. And then they've rewarded us, super, super well in terms of expanding their business with us, introducing us to other wonderful partners. And so that's just been an amazing ride. And, we haven't ruled out going after a bunch of other segments and, being an unstructured to structured, data processing company for all of healthcare. But, for the immediate future, we're loving being able to just lean into just a truly
mm,
wonderful set of partners and make sure that they're served, to the max before we go island hopping.
mm. So I'm just even just thinking because you're seeing systems from the inside, and now you're sort of rebuilding one. What do you think is harder, fixing the old or designing the new?
Um, oh, definitely designing the new. Definitely designing the new. Because as great as it is, for folks to be visionary and think about the ways that things, could be tomorrow, as exciting as all that is, I think it's just way more exciting to think about, where we're starting from. The US healthcare system is set up in a very, very particular, set of ways. And we really need to understand and embrace the current structures and incentives and all of that. Otherwise, it would feel like we're building a house on a foundation of sand. So I think, yes, super exciting to think about the art of the possible and where we can get to in 5 or 10 years. But I think to do so without acknowledging and embracing and being thoughtful to the current realities is just, a bridge to nowhere.
Yeah, you said 10 years, and I'm just curious if imagine someone is listening to this, maybe a decade from now. I mean, what's like one thing that you hope that they take away from the way, you built Oler Health?
I would say for me, I just feel so grateful and so fortunate to having leaned in, and not
Yeah.
not setting out to build a company by buzzwords and that sort of thing, but rather, spend time with the patients that you're going to be, ultimately supporting, and then leaning in and being shoulder to shoulder with the clinicians who day to day are taking care of those patients. To me, that's made things just really, really tangible. I think explains a lot of our early wins. And it's just really, really fulfilling and really fun.
So what's the best way that people can follow your journey, Justin, follow Oler Health, maybe kind of give a little bit of a just sort of commercial way people can keep tabs on your journey?
Sure. I would say definitely feel free to, reach out on LinkedIn, send a connection request, follow Oler Health, shoot a message over. Always happy to meet great new folks.
Justin, this has been great. It's been great for a number of different reasons. And I have to say that, typically it's not the norm where people are sharing the journey, sharing the fact that they bootstrap something, that they are creating raving fans of customers, and those customers, in essence, are becoming their best commercial engine. And the fact that you're doing it and doing it in this environment, doing it with a very unsexy problem, however, that problem is very, very important. Tip my cap to you. And for those that have tuned in, if you found this content particularly helpful for you, found this conversation helpful, just a couple of things. Would you mind just liking it wherever you are? Hit the notification bell, or just would you mind sharing it on social media with your network, with people that you think would benefit from this? I'm grateful when these conversations make a difference. Maybe it's someone who's on the sideline thinking about starting something, they're thinking about diving deeper into a problem, but they haven't necessarily taken that next step. Maybe this is the spark, this conversation that sparks them to take that next step. So that's what I look for. And there's only one thing that you can do as an innovator. It's about taking action. So Justin, I'm looking forward to having you coming on in the future at some point. Obviously, the door is always open to share more of the journey, but looking forward to that next conversation. Thanks for today.
Yeah, no, thank you, Michael. Really appreciate the chance to join the Advancing Healthcare Innovation podcast, and great catching up as always.